Hi, today I am going to talk on anticholinergics, that is muscarinic receptor antagonist. Now these drugs are mainly classified into three categories: natural alkaloids, that is atropine, which is obtained from Atropa belladonna; scopolamine, also known as hyoscine, which is from Hyoscyamus niger. The semi-synthetic derivatives are hometropine, atropine methonitrate, ipratropium, tiotropium. In the synthetic drugs, the examples are like tropicamide, cyclopentolate, propenthyline, oxyphenonium, acridinium, etc. So we will take these drugs into different categories of organ system. The action of anticholinergic is primarily represented by atropine, which is the prototype drug in this category, and the response varies, or the action varies, based on the dose as well as the organ which is supplied by the parasympathetic or cholinergic system. Now the small dose of 0.5 milligram causes slight slowing of the heart, and there is a dryness of mouth. If the dose is increased to 1 milligram, then there is thirst, there is a fast heart rate, and there is a pupillary dilatation. If the dose is 2 milligrams, then it is a rapid heart rate, there is dilated pupil and mild blurring of vision. If the dose is increased to 5 milligrams, it causes difficulty in speech, difficulty in swallowing, restlessness, fatigue, headache, hot skin, urinary difficulty, etc. And a very high dose of 10 milligram causes marked symptom of blurring of vision, skin flushing, dryness, ataxia, that is incoordination, hallucination, delirium, and even coma in certain cases. The atropine poisoning is well known with the old mnemonic, which is red as beet, dry as bone, blind as bat, hot as firestone, and mad as a hatter. These are the primary symptoms, because there is a redness, there is increase in body temperature, there is dryness of secretion, there is blurring of vision, and there is a hallucination. So these are the 5 major symptoms of atropine poisoning, or we call it as belladonna poisoning. The effects of anticholinergics, we will see the organ wise. The heart, there is a transient bradycardia because of its presynaptic M1 block, followed by tachycardia, which is primarily because of M2 block on the SA node, and the effect on the heart rate is poor in infants, elderlies, and in patients with heart failure, because in these patients or in these people the tone of cholinergic system is not prominent. The atropine abolishes the cardiac slowing or asystole due to carotid stimulation. Contrast DIE, overdose of parasympathomimetics, anticholinesterases, and cardiac arrest due to vagal stimulation. The atropine facilitates the AV conduction and lessens the AV block, and because of this it is used for the treatment of inferior or posterior MI by relieving the nodal bradycardia or AV block. The respiratory system, anticholinergic causes relaxation of the bronchial muscles. For the same reason it is used for bronchial asthma and COPD, because it causes dilatation of the bronchial muscles. It inhibits the secretion of nose, pharynx, bronchi, causing dryness of mucous membrane. and that is why it is sometimes used in the treatment of rhinorrhea and allergic rhinitis. The effect on respiratory secretion is undesirable and reduces the mucociliary clearance and resulting into mucus plug. So it is not a very preferred drug for reducing the secretion into the respiratory tract. Some of the quaternary ammonium drugs like ipratropium or tiotropium, acridinium and umeclidinium are exclusive on their effects on respiratory tract without adversely affecting the secretion and mucociliary clearance. And because of these drugs are primarily used for the treatment of COPD or bronchial asthma. This effect on eyes, if we see anticholinergics, they block the pupillary sphincter muscle and ciliary muscle. As a result of it, they cause dilatation of the pupil, that is mydriasis, and paralysis of the ciliary muscle. We call it cycloplegia. As a result of these, there is a photophobia, blurring of vision, and loss of pupillary light reflex because of these drugs. The effect of anticholinergic on local application produces ocular effect which lasts for 7 to 12 days in case of atropine, and it is variable in other drugs. We will take that point later. The shorter acting mydriatics are used in the ophthalmological conditions for dilatation of the pupil and for ophthalmological examination. The local or systemic use of muscarinic antagonist may increase the intraocular pressure, resulting in glaucoma. So, in patient with glaucoma, the use of these drugs should be with great caution. On the gastrointestinal tract, the anticholinergic drugs, they have inhibitory effect. They reduce the tone, amplitude and frequency of muscle contraction. They inhibit the peristalsis. They inhibit the gastric secretion due to vagal stimulation, and they even inhibit the salivary secretion. These drugs, because of their effect on the gastric secretion, were used for the treatment of peptic ulcer diseases in the past, but now there are better drugs available, and so the use of these drugs for gastric secretion is almost negligible. The effect on CNS is very minimal, but the toxic dose of atropine may cause CNS excitation with restlessness, irritability, hallucination or delirium. And this CNS excitation can be followed by CNS depression, which can cause collapse, respiratory failure and coma. Scopolamine or hyoscine, which is an anticholinergic drug, a natural alkaloid, it has got a central effect because it is easily crossing the blood-brain barrier, and so it causes CNS effect primarily in form of CNS depression. If we see the therapeutic uses of this class of drug, initially, first we will see into respiratory tract. As we have seen that it causes bronchodilation, so they are used for the treatment of COPD, that is chronic obstructive pulmonary disease, along with beta-T agonist. They are also used in asthma, but their efficacy in asthma is less as compared to what we see in case of COPD. The drugs which are used for COPD are ipratropium, which is given 4 times a day because it has got a short half-life of only 2 hours. It is used in form of nebulizer or in meter dose inhaler. Ipratropium is also used in form of a nasal inhaler for treatment of rhinorrhea, which is associated with rhinitis or common cold. The other drugs in this category, like acridinium, is used twice a day because it has got a longer half-life of 6 hours. Glycopyrrolate is available also in form of inhalation, which is used twice a day for COPD. Some of these drugs are having a very long action, which are given only once in a day for maintenance therapy for COPD, and the drugs are like tiotropium, which has got a half-life of 25 hours, the umeclidinium, which has got a half-life of 11 hours. So these drugs are used in form of a dry powder inhaler for maintenance therapy of COPD. In the genital tract or genitourinary system, these anticholinergic drugs are used for the treatment of overactive bladder or neurogenic bladder to reduce the frequency of micturition. They reduce the intravesical pressure, that is pressure in the bladder, and so they reduce the frequency of urination. These drugs are also used in the cases of nocturnal enuresis, that is wet bedding in case of children. It reduces the urinary frequency in patients with spastic paraplegia, and also it is useful for the pain relief in case of urinary colic. The main side effect which is expected out of these drugs are dryness of mouth, we call xerostomia, blurred vision, constipation, dyspepsia, dizziness, and drowsiness. Some of the drugs which are used for genitourinary purposes are like derifenacin, which is used in a dose of 7.5 milligram daily. The other drug is oxybutynin, which is given 5 milligram 3 times daily. It is also available in form of a gel, 10% gel. Solifenacin is 5 milligram daily. Tolterodin is 2 milligram twice daily. So some of these are common drugs which are used for neurogenic bladder or overactive bladder in different doses. And the patient who are not responding to any of these drugs, they may require sometime intrabladder injection of botulinum toxin to block the neuronal acetylcholine, and just a single injection of this botulinum toxin, it works for several months. The therapeutic use of anticholinergic in the GI tract is, as we have seen, they reduce the gastric secretion. So earlier they were used for the treatment of acid peptic disorder, but because of better response of S2 receptor antagonist and proton pump inhibitors, these drugs are not very commonly used. The two drugs which are called perenzypine and tilenzepine, which are more selective M1 antagonists, are used for acid peptic disease. They are available in Europe, Japan, and Canada, but their efficacy in peptic disorder is as good as S2 receptor antagonist. So we can say that they are not a very powerful or very effective drug as compared to available therapies. Now, anti-muscarinic drugs with anti-anxiety effects are also used for the treatment of irritable bowel syndrome. Some of the drugs which are used are like dicyclomine, hyoscyamin, which has got antispasmodic effect. They are used for colic, abdominal colic or intestinal colic, and also in patients with diarrhea predominant with irritable bowel syndrome. The glycopyrrolate, it reduces the salivary secretion and commonly used for the treatment of drooling in Parkinson's disease, because some of these patients of Parkinson's, they have uncontrolled salivation leading to excessive salivary secretion or drooling, which is quite embarrassing and leading to a lot of other side effects. So glycopyrrolate is used to reduce the drooling in those patients. And glycopyrrolate does not have the CNS effect, and so it is purely a peripheral drug. The atropine is used in form of a drug called Lomotil, which is a very popular drug, even OTC, and this drug is used with a synthetic opioid called diphenoxylate for the treatment of traveler's diarrhea. Some of the anti-muscarinics which are used in GI tract are like atropine, which is used in dose of 0.4 milligram 3 to 4 times a day, dicyclomine 10 to 20 milligram 3 to 4 times a day, Acridinium 2.5 milligram 3 to 4 times a day, propanthyline 50 milligram 4 times, then trospium, which is given 20 milligram twice a day, oxyphenonium 5 to 10 milligram twice a day, and glycopyrrolate 1 milligram twice to 3 times a day. So these are some of the drugs which are used for the conditions related to GI tract. If we see the therapeutic uses of anti-muscarinic in ocular conditions, they are primarily used in form of a topical preparation, topical solution. They cause mydriasis, that is dilatation of pupil, and paralysis of ciliary muscles, that is cycloplegia. They are used for fundal examination, retinal examination by causing mydriasis. And because of their cycloplegic effect, they cause paralysis of ciliary muscles. They are used for the treatment of keratitis, that is inflammation of cornea, iridocyclitis, that is inflammation of iris and ciliary body. They are used for corneal ulcers, because in these conditions of keratitis, corneal ulcers, etc., we have to produce cycloplegia to provide rest to the eye. And also, this anticholinergic drugs or anti-muscarinic drugs, they prevent synechia, that is formation of adhesion between the tissues. So they prevent any further ocular damage because of these inflammatory conditions. Some of the drugs which are used in ophthalmology, anti-muscarinics, are atropine, which is used in a concentration of 0.5 to 1%. The duration of action is 5 to 6 hours, 6 days. It is very long, and that is why it is not commonly used. The better drugs are homatropine, which is given in concentration of 2 to 5%. The action lasts only for 12 to 24 hours. The cyclopentolate, which is a short-acting drug in a concentration of 0.5 to 2%, acts only up to 3 to 6 hours. The tropicamide is the shortest acting anti-muscarinic in ophthalmology, which is used in concentration of 0.5 to 1%, and the effect lasts only for 15 to 60 minutes. In the cardiovascular system, anti-muscarinic are used only in the coronary care settings or in surgical settings. As we have seen, they can be used for acute MI, primarily inferior MI, where there is excessive bradycardia, and to counteract the atrioventricular block. These drugs can also be used for the treatment of bradycardia due to hyperactive carotid sinus reflex, and sometime in the cases of digitalis toxicity when there is excessive AV block. So atropine and these drugs have some role in cardiovascular setting as well. In the CNS, the main use of anti-muscarinic is for prevention of motion sickness, and for that we have a drug called scopolamine or hyoscine, which is the most effective drug, which is used prophylactically in form of a patch, scopolamine patch, which is used prophylactically, but it is not effective once the symptom of motion sickness develop. Patches are used behind the ear and is a very popular drug because of its central effect. Anti-muscarinic drugs or anticholinergic drugs are used for the treatment of Parkinson's disease, primarily in the young people who are having tremor as a predominant symptoms, especially in the early stage of the disease. And these drugs are also used if the patient develop extrapyramidal symptoms due to antipsychotic drugs. So people who are having schizophrenia, who are on chronic therapy of antipsychotics, showing extrapyramidal symptoms, they are treated with anticholinergic drugs to counteract the extrapyramidal symptoms. The drugs which are used for Parkinson's disease are for the prevention of extrapyramidal symptoms due to antipsychotics are benztropine mesylate in a total dose of 1 to 6 milligram, piperidine 2 to 12 milligrams, trihexyphenidyl 6 to 20 milligrams, procyclidine 7.5 to 30 milligrams, and orphanedrine 150 to 400 milligrams per day. So these are some of the drugs which are used in antimuscarinic category for Parkinson's disease. The therapeutic use of antimuscarinic is also seen in anesthesia, primarily atropine and glycopyrrolate. They are used to block the neostigmine effect after surgery. Neostigmine is given sometimes to block the effect of for the cholinergic effects, and to block this neostigmine effect, sometimes atropine or glycopyrrolate is used if there is excessive secretion in the respiratory tract or few other things. Atropine is also used for the treatment of anticholinesterase poisoning or organophosphorus poisoning, insecticidal poisoning, and it is kind of an antidote. Atropine is an antidote for organophosphorus poisoning. And the drugs which are used for the treatment of myasthenia gravis, like pyridostigmine, the overdose of these drugs, again, they are treated by drugs like atropine or other anticholinergics. The important precaution and contraindication of using anti-muscarinics are urinary obstruction, gastrointestinal obstruction, acute glaucoma, prostate enlargement, because these conditions are worsened by the use of these drugs, dryness of mouth, blurred vision, constipation, dyspepsia, cognitive impairment are some of the important precautions and contraindications. And these drugs may cause poisoning, or there is a risk of poisoning primarily in children if they are used topically or in form of antidiarrheal drugs or for scopolamine. So one should be very careful of using these drugs in children either topically or in form of a patch or in form of a tablet. Thank you.